about the antenatal examination. Under antenatal examination, mainly 4 parameters are common. The first one is inspection. Second one is fundal height. Third one is fundal palpation. Fourth one is fetal heart rate. So under antenatal examination, mainly 4 parameters are coming. First one is inspection. Second, fundal height. Third, fundal palpation. Fourth, fetal heart rate checking. Let us see one by one now. Inspection, we know the meaning of inspection is by looking by our eyes. Inspection is also called as objective signs or probable signs. We are inspecting for the probable signs. What are the probable signs that we explained in the signs and symptoms of the pregnancy? Or this is also called as objective signs. With the eyes we can see. What are they? For example, stria gravidarum, linea nigra, any skin rashes, or any injuries are there, any previous scars, skin scars. We'll have to check for the even skin scars also. What do you mean by scars? If mother had undergone for the previous LSS, then we can see previous scar of LSS, lower segmental cesarean section. You all know what do you mean by stria gravidarum. Stria gravidarum, the pink stretch marks on the pregnant woman abdomen. And linea nigra, the straight pigmented line extending from the zippy sternum to the symphysis pubis is called as linea nigra. And any skin rashes in case of mother is allergic to some medications or allergic to some foods, or even though if there are no allergies also, there is a chances of having skin rashes in general. We have to check for this, all the signs in the inspection aspect. In the inspection aspect, we will have to check for all these probable signs or objective signs of pregnancy. Next one is fundal height. The fundal height, so according to the gestational age, the fundal height will be increasing according to the gestational age. We check the fundal height from the top of the symphysis pubis to the zippy sternum, or from the height of the uterus fundus. For example, the height of the uterus is here at the 36 weeks. You have to keep the tape unflexible tape. You have to keep the unflexible tip of the tape on the fundus, and from fundus to here at the top of the symphysis pubis, we will have to check by using the tape. We will have to check by using the tape. That is called as fundal height. This is very much important for your clinical examination. We will have to check the fundal height of the uterus from the fundus, the fundal height of the uterus to the top of the symphysis pubis by the help of the unflexible or tape. That is called as fundal height. What is the purpose of taking the fundal height is to check according to the gestational age whether the fundus, the uterus is growing or not. That means either the fetus, the baby inside the uterus is growing or not. We will have to check by using the fundal height. If the uterus is not growing according to the gestational age, or the baby, that means it is indicating that the baby inside of the uterus is not growing properly. Why we should check the fundal height of the uterus? To check the baby growth in the uterus is growing according to the gestational age or not. In case the fundal height is lesser than the gestational age height, it indicates the intrauterine growth retardation. Intrauterine growth retardation. So, if we start, what is the fundal height of the uterus according to the gestational age means? The fundal height of the during the 12 weeks, the fundal height of the uterus is just above the symphysis pubis. Just above the symphysis pubis. And during the 16 weeks of gestational age, the fundal height lies between the symphysis pubis and between umbilicus. 16 weeks between umbilicus and symphysis pubis. This is called as symphysis pubis. And at 20 weeks of gestational age, it reaches to the umbilicus. It reaches to the umbilicus. At 20 weeks of gestation, it reaches to umbilicus level. And at 24 weeks of gestation, it is just above the umbilicus at 24 weeks. And at 28 weeks, it grows further and reaches it lays between the xiphoid process and between the umbilicus. These three gestations are lays between the umbilicus and xiphi-sternum. 32 weeks also. But remember, what the main point here you have to remember is, at 36 weeks, it touches almost the xiphoid process of sternum or xiphi-sternum at 36 weeks. 36 weeks, it touches almost the xiphi-sternum. But at 40 weeks, you may get the doubt that at 46 weeks, it comes down. The fundal height of the uterus comes down. Why? Baby engages into the pelvic region. Baby engages into the pelvic region to start up with the delivery process. That is the reason during the 40 weeks the fundal height reaches below the xiphoid process. Next one is fundal palpation. Under fundal palpation, there are mainly 4 grips comes. Either we can call grips or manuals or palpations. What is the first palpation? Fundal grip or fundal palpation. Next one is lateral grip or lateral palpation or second manual. And third one is Paulick's grip or Paulick's palpation or third manual. Fourth one is pelvic grip or palpation or fourth manual. Let us discuss now one by one in detail. Okay, first one is fundal grip or fundal palpation. Fundal palpation, I already told you, the highest point of the uterus is called as fundus. By placing our hands on the fundus, we are just checking on the fundus of the uterus. Why we are checking? Our hands are against the face of the mother and checking, palpating the fundus of the uterus. This palpation is to know where the head and where the buttocks are present, where the breech are, where the head is present. If the breech presentation is there, we can feel the fine or bicornuated, like the dip inside. Buttocks are present at the top of the fundus. If the head is present, we can feel the hard and spherical shape thing on the top of the fundus. By that we can determine that the head is on the fundus. Okay, if it is soft and tip is there in between our two hands, that means buttocks is present. The fundal palpation is by using our two hands. We'll have to place our two hands on the top of the fundus of the uterus and palpate gently and deeply to know the position of the head and the buttocks or breech of the baby. This is the main purpose of fundal palpation or fundal grip or first manual. Now, lateral grip. Second one is lateral grip. In the name itself, we can see that lateral. We'll have to place our hands laterally to the abdomen. Laterally to the abdomen of the mother and check gently and finely by pushing in to check which side actually the baby's back side is present. This grip is to check which side the baby's back is present. How can we feel if the resistance is there? Backside is resistance is there because backbone is present. If in case nodules are present, that it indicates the hands or limbs are present on the particular side. If resistance is there, then we can find out on the resistant side back is present. The lateral grip is, we will have to palpate the lateral side of the abdomen of the mother or the uterus lateral sides. We will have to check gently and finely by using lateral position to check which side the back of the fetus is present. Baby is present. Understood? Next grip is, third one is Paulic grip or third maneuver or Paulic palpation. In this palpation, we do this palpation to know whether the head is fixed in the pelvic region or not. This grip we do to check the head of the fetus is fixed in the pelvic region or not. Okay, by using our hands, so by keeping four fingers aside and thumb finger aside, we support the head of the fetus and try to move it. If in case it is moving, the head of the fetus is moving, that means the head is not fixed in the pelvic region. If it is not moving, it is a little bit resistant, then we should fix that it is fixed, right? If the head is fixed in the pelvic region, we cannot move by using this grip. If it is not fixed, it is just above the pelvic region, then we can move by using this grip. This grip is called as Paulick's grip or Paulick's palpation or third maneuver. So in this grip, we are using this type of grip is to know whether the fetal head is fixed in the pelvic region or not. So next one is pelvic grip or pelvic palpation or fourth maneuver. In this fourth maneuver, we are using this grip to know how flexible of the head, fetal head against the pelvis. By we are facing the feet of the patient and we are keeping our hands opposite to the feet of the patient and we are checking by using this way. Our hands should go opposite to the symphysis pubis and place under it to check how much the head of the fetus is flexed, how much the fetus head is flexed. These all the fundal grips are useful to know how the fetus is engaged in the pelvic region or whether it is a transverse lie. These are all the palpations we use to know lie, position and attitude of the fetus against the uterus. Right? Lie, attitude and position of the fetus against the uterus. Why we do want to check these all the palpations? To know how much possibility of for the normal pregnancy, and also when we check for the back of the fetus, we can check the fetal heart rate also, right? Where the side of the back side of the fetus is present, on that side only the heartbeat we can feel it. Okay, and remaining aspects we will discuss in the next class.